I've worn glasses and contacts for about 25 years now, and I think doing sports, in particular skiing with glasses and contacts, was particularly difficult, and thought it might be time to get out of them. I didn't mind wearing glasses that much, especially if I was at the office or if I was just around the house, but I think that, like I said, if you're outside in the cold and you come inside of the house when the glasses would fog up, and same thing with my contacts drying out on a regular basis. I think the dry contacts was really a frustration for me. I really wanted to get out of that. Well, I am an optometrist here in Austin, so I see a lot of LASIK cases come through my office, and there are a number of good doctors in town. However, I've always had a really good sense about Dr. Walters and the work that comes out of iLASIK Austin. The patients always come through with a wonderful sense of certainty and security when they come through, and the jobs always look beautiful. So I felt like I've been working here as a doctor for about 4 years now, and I just had a really, really good sense about iLASIK Austin. The process is very thorough and very efficient. The tech spent probably a good 30-35 minutes with me talking about the surgery, what would happen, what I could expect, options I had, and the screening process was also very thorough and efficient. I felt like everything was very carefully checked out, and I didn't have any concerns about whether I was a good candidate or not. Oof, the technology is first rate. I think the lasers that iLASIK Austin is using are the forefront of technology. I felt like I was getting a really first-rate, cutting-edge job on my eyes, and when it comes to coming up with a prescription that you're going to have for the rest of your life, or a correction for the rest of your life, I think you and me and everyone else would want something that was perfect. So I think the technology is great. I wasn't probably nervous. In fact, I worked a half a day prior to going in that day. I didn't really think about it much. I probably wasn't nervous until I got into the pre-op room, and that's when my heart started beating a little bit faster. But I had a friend who'd gone before me, and she had said it's kind of like when you're getting your teeth cleaned or something like that. You have to just kind of lay back and trust that they know what they're doing, and just let them work. And I think it was a little bit of a mind over matter thing for me when I just sort of relinquished control and relaxed and let them work. I really wasn't nervous at that point. And of course, Dr. Walter's staff had offered me a pill to make me feel a little bit better, which gave me a little added confidence as well. So everything, wasn't nervous at all during the procedure. It was for sure easier than I expected. It went exactly like the staff had suggested. So I got there, was prepped in a pre-op room, and then Dr. Walters came in and explained to me kind of what he was going to do. He told me that my case was very clear-cut and easy to do, and we went together into the surgery room, and boy, it was just the easiest thing in the world. Moved me around a few times between the different lasers, and I think probably the most interesting thing was at no point did I really ever feel any frank pain or even discomfort. I mean, it was really pretty pleasant experience the whole time. And I would also add that it was nice the whole time. The techs who had worked me up prior to the surgery, and Dr. Walters, of course, were all in the room, and I could freely converse with them during the procedure. I would say probably the most important thing is to talk to people who've had it done. I've talked to friends who are considering it, and I can tell them about my experience. And I would say universally, patients who come through my office who have had LASIK at iLASIK Austin have had all very, very good experiences, and that certainly helped calm my nerves as well. And I think what I recommend to my patients is just to go to iLASIK Austin and have a screening done. It doesn't cost anything except for a little bit of their time, and they can learn about their eyes and the procedure from the experts who do it every day. It's fantastic. I just got back from skiing 2 days ago, and boy, I can't even tell you. In low light, I see wonderfully. I stand in the exam room with my patients, and I'll ask them what the lowest line on the chart that they can see is, and I know that I can read right down to the 2015 line with no problem, 2010 on a good day, and boy, it's as crystal as it's ever been. Absolutely. I mean, I recommend Dr. Walters at iLASIK Austin almost every day. I think he's a fantastic doctor, fantastic surgeon, and a real nice guy too.